Hello everyone, myself Dr. Darshana, Senior Resident in the Department of Community Medicine in Lakshmi Narayan Institute of Medical Science. So today we are going to learn about rabies. In this session, I will be covering the introduction of rabies infection, the clinical features, laboratory diagnosis, epidemiological factors, treatment and prevention of rabies. So we will start our session with the introduction of rabies. So it is a communicable zoonotic disease of a warm-blooded animal. So zoonotic disease means the disease which are transmitted from the animals to men, such as a brucellosis, in which the disease is transmitted from the cattle. So here in a rabies, the disease is transmitted from the animals like dogs, cats, jackals, and wolves. Majority of the infection are reported because of dog bite only in 95% cases. Other 5% cases are reported because of the cats, jackals, and wolves. It is manifested as a acute encephalomyelitis. So, what is encephalomyelitis? It is a inflammation of a brain and spinal cord. So you can see the disease is very severe as it is involving the nervous tissue, which can be in an irreversible state. That is why in this disease, the fatality will be reported as 100%. So it is the only communicable disease of a man which is having 100% of the fatality. It is also known as a hydrophobia. Hydrophobia means fear of water. So in the later slides, we will discuss about the clinical features of a rabies, in which we will see how the patient is not even able to swallow the water, which is termed as a hydrophobia. So these are the animals which are responsible for the transmission of infection. If we see the global problem, every year 60,000 of the human deaths are reported because of a rabies infection. And if we see the 10 million people who are requiring globally for the post-exposure treatment. Few areas are reported as a rabies-free area. So what is rabies-free area? It is defined as a area in which there is a no case of indigenously acquired rabies occurred in a man or any of the animal species for 2 years. So the area which is not reporting any single case of a rabies in a minimum duration of 2 years, we will label it as a rabies-free area. Approximately 35,000 to 40,000 human deaths occur due to rabies in each year of the country of a Southeast Asia region. And Maldives is the only country in the region which does not have the human or animal rabies. If we see about our country, it belongs to high incidence category of rabies. In India, except Lakshadweep and Andaman Nicobar Islands, all part of the country is reporting the rabies infection. More than 30,000 deaths per year. It is estimated that according to the WHO report, these deaths are because of rabies. But if we consider the underreporting, the actual scenario will be 10 times higher than the reported deaths. More than 95% of the cases are due to dog bites. And dog population in India is around 25 million. And most of the dogs are not vaccinated for the rabies. Epidemiological factors. Agent of rabies is a Lisa virus type 1, which belongs to the rhabdovirus. This diagram you are seeing a bullet-shaped rhabdovirus, rabies virus, which is enveloped by the glycoprotein, and the internal protein is known as a ribonucleoprotein. So basically, rabies virus is having two type of protein, glycoprotein, and one is a nucleoprotein. Now, other serotypes are also there, which causes the similar kind of rabies illness. That is serotype 2, 3, and 4. But the antigenic variation of this virus, which will differ in the laboratory diagnosis. So the rabies vaccine will be only effective against the serotype 1 and not against the serotype 2, 3 and 4 because of the variation in the antigenic structure of a virus. And remember, the rabies virus is a RNA type of virus. This glycoprotein, which is seen in the membrane of the virus, is capable of producing antigen and which later on induces the formation of a virus neutralizing antibodies. And recently, the surface glycoprotein has been cloned and expressed in an E. coli to develop the genetically engineered rabies vaccine. So rabies virus manifests as a two types of virus, street virus and fixed virus. So what is street virus? It is recovered from the naturally occurring cases of a rabies. And the street virus is pathogenic for all the mammals. It shows the longer variable incubation period like a 20 to 60 days in a dogs. It used for the production of a fixed virus. So the second type fixed virus is a produced from the street virus only. How? That it undergoes several brain to brain passage formation. It will modify and create a new structure which is known as a fixed virus. So basically, fixed virus is just a modified version of a street virus. And the fixed virus does not form the Negri bodies. What is Negri bodies? Negri bodies are intracytoplasmic inclusion in the neurons of a rabies infected patients. So it is a pinkish purplish color oval bodies which you will find in the microscopic feature of a neurons. And this Negri bodies, it is made up of rabies proteins and the other materials. Not and this fixed virus, it does not multiply in a extraneural tissue. While the street virus can multiply in a neural as well as the extraneural tissue. The fixed virus is used in the preparation of a anti-rabies vaccine. Fixed virus incubation period, if you compare with the street virus, it is very shorter. It is only 4 to 6 days, while the street virus is having 20 to 60 days of incubation period. Reservoir of this infection. So what is reservoir? In reservoir, the infectious agent will live, multiply and grow, but it may or may not transmit the disease. So in this case, the reservoirs are dogs, raccoons, the bats, jackals, cats, etc. Source of infection. Here the source of infection is a saliva of a rabid animal. If the dog is biting due to intact skin, but it transmits the saliva which is infected, it can be the source of infection. So in a dog and cat, the virus may be present in a saliva for up to 3 to 4 days before the onset of the symptom and during the course of illness till the death. Host factors. If we see age and gender, both are having equal risk of developing the disease. But in India, most of the cases are reported from the age group of 1 to 24 years. All warm-blooded animals, including men, are susceptible to the rabies. And rabies is the dead end of the infection. After men, it cannot be transmitted further, so it is a dead end of the infection. Just remember this point. And it has no survival value for the virus. Who are the people at the risk of developing this infection? So they are laboratory staff working with the rabies virus, veterinary doctors, dog handlers, hunters, and the field naturalist. So these are the people who are eligible for the pre-exposure prophylaxis of rabies. Now, mode of transmission. There are 4 ways of mode of transmission of rabies. First is a animal bite, second is a leak, third is a aerosol transmission, and fourth is a person to person transmission. So first one, the most common one is a bite by the animal. In India, the rabid dog means the dog which is infected with the virus, that is known as a rabid dog. So that rabid dog bite is the most important for most of the human rabies cases. Occasionally, the transmission occurs from other animals also, like a cat, monkey, horse, sheep, and the goat. The second mode of transmission is a leaks. So leaks on the abraded skin and mucosa, either abraded or unabraded, that is intact skin, can transmit the disease. Rarely, disease can occur by accidental injury with the bone splinter or other object contaminated by the saliva of a rabid animal. The third transmission is a aerosol transmission, less reported, but yes, in observe that it is between the vampire bats which are in a caves. In the laboratory, how we transmit that when the laboratory workers are doing the virus isolation in a process of homogenization, in that process, the transmission is occurring from the air and it infects the laboratory workers. The fourth one is a person to person transmission, which is very rare, but it is possible. The reports are suggesting that one rapid infected child has bite the parent and the parent had the rabies infection. So it is very rare, but it is possible, and it can also occur by the corneal and organ transplant. So these are the four ways of transmission of a rabies. One is a licks, aerosol, person to person transmission, and the most common is a animal bite. Incubation period. What is incubation period? It is a period from the exposure to the initial symptom development. So whenever the agent enters into the body, from that the symptoms, like here in the rabies, the symptoms are like hydrophobia. So development of the symptoms. This period is an incubation period, and here it is commonly 3 to 8 weeks following the exposure, but may vary from the 4 days to many years. In general, incubation period tends to be shorter in a severe exposures and bite on the face, head, neck, upper extremities, and bites by the wild animals. Because the face, head, neck involvement will directly lead to the spread in the nervous tissue faster as compared to the other sites, peripheral sites like lower extremities. So in this scenario, the incubation period will be shorter. So these are the factors which are responsible for the length of the incubation period. The first factor is a site of the bite. As we have already discussed, if it is in a lower extremity, the incubation period will be longer. Second is a severity of the bite. How the deep wound is. That is also important for the length of incubation period. The third is the number of wounds. If you see the incubation period of a single wound compared to the multiple wound, it will be quite longer in a duration. Amount of a virus injected. Another factor is a species of a biting animal and the protection provided by the clothing and treatment undertaken. So these are the factors responsible for the length of an incubation period. This diagram shows the pathogenesis of a rabies in a human. So how this virus is spreading from the extremity to the nervous tissue, and at the end stage it involves the eye, salivary gland and the skin and other organs. So first, via the animal bite, it will enter to the skeletal muscle of the extremity. There it will multiply, it will replicate, and it will travel through the peripheral nervous tissue, ascends through the sensory fibers. It replicates again in a dorsal ganglion. Then the rapid ascent towards the spinal cord. Ultimately, it infects the spinal cord, brainstem, and other brain structure. The end stage of this rabies will involve the eye, salivary gland, and skin and other vital organs. So, which will lead to the coma and death. Clinical picture of rabies. In men, it manifests as a hydrophobia. As I earlier mentioned, it is a fear of water. Just by looking the water, patient will have the gagging or laryngeal spasm, choking. So patient won't be able to drink the water, in which we have to be very careful about the hydration of the patient. In men, clinical feature is divided into the four stages: prodromal stage, acute encephalitic stage, coma, and death. So we'll see all the stages one by one. First is a prodromal stage, in which the features will be fever, headache, malaise, fatigue, and anxiety. The second stage is a acute encephalitic phase, in which the patient will have the neural involvement. Because of that, hyperactivity will be seen with the intermittent seizures. Other feature is a aerophobia. It means it is a fear of a flying. Hydrophobia, painful spasm, choking, gagging. It occurs when we give the forceful water to drink to the patient. Patient will develop the painful spasm, choking, gagging, and ultimately it will result into the coma and death. Now, how to diagnose the rabies? So we will see in a human also and in a dog also. First, we'll see the human method of diagnosis the rabies. Most commonly, we will demonstrate the rabies virus by detecting the antigen. For that, we are using the immunofluorescence method. So, most common laboratory diagnosis method is a antigen detection by the immunofluorescence. The specimen tested are a corneal smear, skin biopsy, saliva in an antemortem case, and if a postmortem, we can take the neural tissue also from the brain specimen. The higher titer antibodies are present in a CSF in a rabies, but not after immunization. So you have to be very careful. If you are taking the sample after vaccination, you will not get the high titer of antibodies, as it will be already neutralized by the vaccine, which can be given the false negative result. So always we take the CSF collection sample from the patient who are not immunized. Detection of a rabies virus RNA by the RT-PCR, that is reverse transcription polymerase chain reaction. It is a sensitive method. More rapid and the sensitive method is a virus isolation from the tissue culture cell lines. We'll isolate the virus from the sample and we will grow in a culture media of the laboratory. A positive immunofluorescence test can be obtained as early as 2 to 4 days after bite. And diagnosis made in a post-mortem by the demonstration of a Negri bodies. So Negri bodies is a classical feature of a diagnosing the rabies infection. It is exclusive for the rabies infection. In a neurons and a microscopic feature, you will find the Negri bodies in a post-mortem. Now, what will be the feature or picture in the dog for the rabies? So it is of a two type. One is a furious type and one second is a dumb type of rabies. So dog will initially become restlessness, which is prodromal symptom in a dog. So in a furious type of a rabies, which is most common type of rabies, what will happen, the dog shows the signs of a drooling of saliva from the dropping the lower jaw. There will be excessive salivation. Then dog bites without provocation. So that is furious type of rabies. Another is a dumb type of rabies. Dumb type of rabies will see the paralysis in a dog, and if you compare the dumb type of rabies with the paralytic furious type of the rabies, both are equally dangerous. So in a dog, if the rabies is infected, we will see the features like excessive salivation. The dog will become restlessness. It will be aggressive and it loses the fear of people. It bites the people without provocation. These all are prodromal symptoms. Later on, it goes to the paralytic stage and at the end, coma and death. Likewise, the rabies infection will progress in a dog. Laboratory diagnosis in dog. Brain of a dog is used for the testing. In that also, same method, antigen detection by the immunofluorescence. So demonstration of a rabies antigen by a immunofluorescence, that is common method for men and dog for the diagnosing the rabies infection. It is a specific test for the diagnosing, and it is a biological test. It is the advantage, it has the advantage because it gives a immediate result. Now, antibodies, as I've already mentioned, it is intracytoplasmic inclusion, round or oval purplish pink structure with characteristic of basophilic granules. So here in this picture, you can see this is normal neuron. Here the neuron is from the infected rabies patient. Here, if you see, there is a oval pinkish purplish color structure, that is nagribodies, which is not seen here in the normal neuron. So this nagribodies is a classical feature of diagnosing the rabies infection. This nagribodies varies in the size like a 3 to 27 micrometers. It is a biological test, and growth of the virus in a brain of a mice after intracerebral inoculation. Treatment of a rabies. So till now there is no specific treatment for the rabies, but how we can manage the patient of a rabies, which includes the isolation from the external stimuli like a noise, cold, bright light. So we will ask the patient to sit in the closed dark room. Then for the anxiety, we can give anti-anxiety drugs, sedatives, analgesic. Analgesic we are giving, most commonly we are using morphine only. That is also up to 45 milligram of a dosage. You can give the repeated dose also. For the spastic muscular contraction, we should give the muscle relaxants, which is having the curare-like action. As the patient is not able to drink the water, we should ensure the hydration and diuresis of a patient. Intensive therapy in a form of a respiratory and cardiac support. So these are the case management for the rabies patient. Now we will see the immunization, which is having the HDC vaccine, which we are giving in a 2 to 3 doses in a pre-exposure manner. So here we can give the specific protection also. The nursing personnel which are at the high risk of the infection should wear the face mask, gloves, goggles, apron, to protect themselves. And certain cases are potentially infectious, and virus may present in the saliva, vomitus, tear, urine, and other body fluids. Now, the most important part of this lecture is a prevention of a rabies. So, it includes two parts. First is a pre-exposure prophylaxis, and second is a post-exposure prophylaxis. So, first we'll start with the post-exposure. The post-exposure prophylaxis is to neutralize the inoculated virus before it can enter the nervous system. So virus has entered the body, but it should not reach to the nervous system. Before it enters to that irreversible stage, we are giving the immunization in a post-exposure prophylaxis. Every instance of a human exposure should be treated as a medical emergency. Now, along with the immunization, we are giving the local treatment of wound also. The first thing which we have to do when the dog bite injury comes to you, first thing you have to do is a local treatment of a wound. And the purpose is to remove the virus from the site of inoculation before it observes to the nerve endings. So local treatment compromises of four things. First is a cleansing the wound, immediate flushing and the washing of the wound by the plenty of a soap and water. You can use a running tap water also. The duration is a minimum 15 minutes. So adequate duration is also important. Less than 15 minutes, the virus can easily transfer, it can easily travel to the nervous tissue. So you have to properly wash the wound with a soap and water for at least duration of 15 minutes. Second is a chemical treatment. For that we are using ether alcohol, tincture and a 0.01% of a aqueous solution of iodine. That is also known as a betadine or a povidone iodine. Third is a suturing. So remember this point, suturing is not allowed immediately after the wound, biting the wound. Why? Because if you immediately do the suturing for wound closure, it results into the multiple puncture, which can facilitate the virus to travel easily and ascends to the nervous tissue. So just remember that suturing is not at all advised immediately after the wound injury. Antibiotics and anti-tetanus measure. So here we are giving TT vaccine and antibiotic drugs for prevention of a local infection. The most important part is the immunization. So we are using CCEEV vaccine in a rabies. So what is that? It is cell culture vaccine and embryonated egg-based vaccine. It is most effective and safe in terms of prevention of disease. Rabies vaccine by WHO do not contain any preservative. The shelf life of this vaccine is 3 years, provided they are stored in a cold chain system which is having the temperature of 2 to 8 degrees Celsius, and it should be protected from the sunlight. As it is a light sensitive vaccine, it should be protected from the sunlight and in a corrected temperature, which is 2 to 8 degrees Celsius. Following the reconstitution, here we are using the sterile diluent for the reconstitution of a vaccine. As is a reconstituted vaccine, it follows the open vial policy and it should be used immediately after opening, that is preferably 4 hours. But if you are maintaining the corrected temperature, you can use till 6 to 8 hours also. These are the categories, depends upon how the wound injury is. For example, if only touching of the feeding animal or licks on the intact skin, it is labeled as a category 1, in which we don't require any kind of post-exposure prophylaxis management. Another one is a nibbling of a uncovered skin, minor scratches or a abrasion without bleeding, which is labeled as a category 2, in which we have to give immediate vaccination and local treatment of wound. If you are having patient with a single or multiple transdermal bites or scratches, leaks on the broken skin, or contamination of a mucous membrane with the saliva from the leaks or the contact with the beds. These four are, if you have any of the feature, it will be labeled as a category 3, the most severe form, in which we are giving vaccination and local treatment of wound. Additionally, we have to give the passive immunization, which is administration of a rabies immunoglobulin. Post-exposure prophylaxis, we are giving two regimen, most important regimen which we can ask in Viva and exam also. That is SN regimen and Zagreb regimen. So SN regimen is 5-dose regimen while the Zagreb is a 4-dose regimen. So what is the difference in a schedule? We'll see in a SN regimen we are giving vaccine at a day 0, that is the day of the injury, then the third day, 7th day, 14th day, and 28th day. So it is 0, 3, 7, 14, and 28 days of schedule. Intramuscularly, we are giving 0.5 or 1 ml of vaccine in a deltoid, and in a pediatric patient, we will give in a anterior lateral aspect of a thigh. So basically it is a 5-dose or 5 vial and 5 visit schedule. So that is SN regimen. If you see the Zagreb regimen, it is 4-dose, it means 4 vial and 3 visit schedule. So how it is 4-dose and 3 visit? Here what we do is during the first visit, that is day 0, we are giving 2-site injection. What it is, will give intramuscular dose of 2 doses simultaneously, one on the right deltoid and one in the left deltoid. If it is a pediatric patient, one on the right thigh and one on the left thigh. So at day 0, the patient will receive 2 doses of vaccine. Then the Zagreb regimen will be followed by the 7th and 21 day. So it is a 0, 7 and 21 days. Here at the 14th day, we are not giving any vaccine. So Zagreb regimen is a 4-dose but 3 visit, 2-site regimen. While the SN regimen is a 5-dose, 5 visit regimen. Is it clear? Both are intramuscular. Now we have intradermal vaccination schedule also, in which we are giving the vaccine at the day 0, 3, 7 and 28. So total we are giving 4 visits, 0, 3, 7 and 28. But here intradermal dosage we are giving only 0.1 ml of vaccine. Previous doses, here we were giving 0.5 ml, 1 ml or 0.5 ml of the vaccine. So intradermal vaccine is having very less amount of a vaccine. So only less than 2 vials will be utilized for the intradermal vaccine. Here we are giving 2 sites. Okay, so on the 0 day of the injury, patient will receive 2 doses. Then on the 3rd day also 2 doses, on 7th day also 2 doses, and same in a 28 days also it will receive 2 doses. But the amount of vaccine, if you see, it is less than 2 vial only. 4 visits are there, 2 sites, intradermal doses is a 0.1 ml per site. So this is intradermal dosage. So we'll quickly summarize the post-exposure prophylaxis: SN regimen, Zagreb regimen, they are the intramuscular regimen, and this are the intradermal regimen. Now, pre-exposure prophylaxis. It is given in a high-risk group. Who are those high-risk group for the rabies? It is laboratory workers, veterinary doctors, then animal handlers, hunters. All these are the at the high risk of the exposure of the infection, in which we are giving pre-exposure prophylaxis. This exposure prophylaxis we are giving intramuscularly only, same as a Zagreb and a SM regimen. Here the dosage is a 0, 7 and 21 or 28. So only 3 visits are required, single site. So 3 doses will be given at the 3 visit. 0, 7, at last 21 or 28. So these are the pre-exposure prophylaxis. So till now we have seen the clinical picture of the rabies virus. We'll quickly summarize the session. The patient is having the hydrophobia, aerophobia, which has the laryngeal spasm. For that, what treatment we are giving? We'll ensure the hydration. We'll keep the patient in a dark room, and the most important thing is for the post exposure prophylaxis, the immunization status, that is Zagreb SM regimen and the intradermal regimen. This much you have to remember for the rabies disease. So with this, I'm going to conclude this session. Thank you.